Hey, what's up everybody? Dr. Mike here. Today's video is all about staying healthy. We're tackling the top 5 illnesses you definitely want to avoid. We'll cover everything from the common cold to more serious conditions like diabetes and heart disease. I'm talking symptoms, prevention tips, and the latest treatment options so you can stay informed and take control of your health. For more content, like and follow for more. Let's kick things off with the one we've all encountered, the common cold. It's a universal experience, something that almost everyone has had to deal with at some point in their lives. It might seem like a minor annoyance, but trust me, it can knock you off your feet for a few days. You might find yourself unable to go to work or school, and even simple tasks can feel overwhelming. What causes this pesky illness? Well, it's not the cold weather, that's for sure. Despite the old wives' tales, stepping out in the cold without a jacket won't give you a cold. It's actually caused by a virus. And there are over 200 types that can infect us. The most common culprit is the rhinovirus, but other viruses like coronavirus and respiratory syncytial virus can also be to blame. So how do you know if it's just a cold or something more serious? This is a crucial question, especially during flu season or in the midst of a pandemic. Well, you're likely dealing with a cold if you've got a runny nose, sore throat, cough, and maybe a slight fever. These symptoms are usually mild and manageable. These symptoms usually appear gradually over a few days and last for about a week or so. Sometimes they can linger for up to 2 weeks, but they generally improve on their own. Now, prevention is key here. It's much easier to prevent a cold than to treat one. Washing your hands frequently with soap and water is your best defense against those pesky cold viruses. Make sure to scrub for at least 20 seconds, getting all the nooks and crannies. And remember, those hand sanitizers are great in a pinch, especially when you're on the go. They can kill many types of germs, but they aren't a substitute for good old-fashioned hand washing. And when it comes to treatment, unfortunately, there's no magic cure for the common cold. It's all about managing the symptoms and making yourself as comfortable as possible. Antibiotics won't work against viruses, so save those for bacterial infections. Using antibiotics when they're not needed can contribute to antibiotic resistance, which is a growing problem. The best thing you can do is rest up, stay hydrated by drinking plenty of fluids, and consider over-the-counter medications to relieve your symptoms. Things like decongestants, antihistamines, and pain relievers can help you feel better while your body fights off the virus. Maintaining a healthy lifestyle can also boost your immune system and help you recover more quickly. Eating a balanced diet, getting regular exercise, and ensuring you get enough sleep are all important factors. And don't forget about good respiratory hygiene. Sneezing or coughing into your elbow and using tissues properly can prevent the spread of the virus to others. If your symptoms persist or worsen, it's always a good idea to consult a healthcare professional. They can provide guidance and ensure that you don't have a more serious condition. Remember, taking care of yourself also means taking care of your community. By following these simple steps, you can help prevent the spread of the common cold and keep everyone healthier. Next up, we're tackling the flu or influenza. Now, this is not your average cold, my friends. Influenza is caused by a different type of virus, and it can pack a much more serious punch. We're talking high fever, chills, body aches, fatigue, the whole 9 yards. One of the biggest differences between a cold and the flu is how quickly the symptoms hit you. With the flu, it's like someone flipped a switch and you're down for the count. It can really knock you off your feet, just like with the common cold. Prevention is crucial when it comes to the flu. Getting your annual flu shot is the single most effective way to protect yourself and those around you from this contagious virus. Now, if you do find yourself under the weather with the flu, antiviral medications can help shorten the duration and severity of your symptoms. But remember, timing is key. These medications work best when taken within 48 hours of getting sick. Chapter 3. Diabetes, Understanding the Silent Epidemic. Let's shift gears now and talk about a chronic condition that affects millions worldwide: diabetes. This condition is not just a health issue, but a global epidemic that requires our immediate attention and understanding. Diabetes is a metabolic disorder that occurs when your body either doesn't produce enough insulin or can't effectively use the insulin it does produce. Insulin is a hormone produced by the pancreas that plays a crucial role in regulating blood sugar levels. Think of insulin as a key that unlocks your cells and allows glucose, or sugar, to enter and provide energy. Without this key, glucose remains in the bloodstream, leading to elevated blood sugar levels. There are two main types of diabetes, type 1 and type 2. Each type has its own causes, risk factors, and treatment approaches. Type 1 diabetes is an autoimmune disease where your body mistakenly attacks and destroys the insulin-producing cells in your pancreas. This type of diabetes is less common and requires lifelong insulin therapy. This type usually develops in childhood or adolescence, and it can be particularly challenging for young patients and their families to manage. Type 2 diabetes, on the other hand, is more common and typically develops in adulthood. However, it's increasingly being diagnosed in younger populations due to rising obesity rates. Type 2 diabetes is often linked to lifestyle factors like obesity, physical inactivity, and unhealthy eating habits. These factors can significantly increase your risk of developing the condition. Now, diabetes is often called a silent killer because many people don't experience any symptoms in the early stages. This makes regular screening and early detection crucial. However, over time, high blood sugar levels can lead to serious complications, including heart disease, stroke, vision problems, and nerve damage. These complications can severely impact the quality of life and even be life-threatening. Managing diabetes involves a multi-pronged approach. It's not just about taking medication, it's about making comprehensive lifestyle changes. This includes monitoring your blood sugar levels regularly, making healthy lifestyle changes like eating a balanced diet and getting regular exercise and taking medications as prescribed by your doctor. Additionally, regular checkups with healthcare providers are essential to monitor and manage the condition effectively. Support groups and diabetes education programs can also play a vital role in helping individuals manage their condition. These resources provide valuable information and emotional support, making it easier to navigate the challenges of living with diabetes. Ongoing research and advancements in diabetes treatment are continually improving the lives of those affected. Innovations in medication, technology, and lifestyle interventions offer hope for better management and ultimately a cure. Community efforts in diabetes prevention and awareness are equally important. By promoting healthy lifestyles and early detection, we can work together to reduce the impact of this silent epidemic. Despite the challenges, many people with diabetes lead full, active lives. With the right management strategies and support, it's possible to live well with diabetes and maintain a high quality of life. Chapter 4. Hypertension, the silent threat to your health. Next up, we're tackling another silent threat to your health: hypertension or high blood pressure. This condition is often overlooked because it doesn't always present obvious symptoms, but its impact can be profound and far-reaching. Hypertension affects millions of people worldwide and is a major risk factor for heart disease, stroke, and other serious health problems. It's a condition that can quietly wreak havoc on your body without you even realizing it. Think of your arteries as highways for your blood to travel through. Just like a busy highway, your arteries need to be clear and unobstructed for smooth blood flow. Hypertension is like having traffic jams in those highways, forcing your heart to work harder to pump blood throughout your body. This increased workload can lead to the heart becoming enlarged and less efficient over time. Over time, this constant strain can damage your arteries and increase your risk of serious health complications. The walls of your arteries can become thickened and less elastic, making it even harder for blood to flow through. The tricky thing about hypertension is that it often doesn't cause any noticeable symptoms, even if your blood pressure is dangerously high. Many people feel perfectly fine and are unaware of the damage being done inside their bodies. That's why it's often called the silent killer. It can quietly cause significant damage over the years, leading to life-threatening conditions without any warning signs. The good news is that hypertension is treatable. With the right approach, you can manage your blood pressure and reduce your risk of complications. Lifestyle modifications such as reducing salt intake, eating a balanced diet, exercising regularly, maintaining a healthy weight, and managing stress can significantly lower blood pressure. These changes can have a profound impact on your overall health and well-being. In some cases, lifestyle changes alone may not be enough to control hypertension. It's important to monitor your blood pressure regularly and consult with your healthcare provider to determine the best course of action. That's where medications come in. There are various types of blood pressure lowering medications available, each working in different ways to help control your blood pressure. Your doctor will determine the best course of treatment for you based on your individual needs. It's crucial to follow their recommendations and take your medications as prescribed to keep your blood pressure in check and protect your health. Chapter 5, COVID-19, Staying Informed and Protected. Finally, let's address the elephant in the room, COVID-19. This virus has dominated headlines and impacted our lives in unprecedented ways. It's caused by a novel coronavirus, SARS-CoV-2, which spreads primarily through respiratory droplets when an infected person coughs, sneezes, or talks. COVID-19 symptoms can range from mild, like a common cold, to severe, including pneumonia, respiratory failure, and even death. Common symptoms include fever, cough, shortness of breath, fatigue, muscle aches, headache, loss of taste or smell, sore throat, congestion, and diarrhea. Preventing COVID-19 is crucial. Vaccination remains one of the most effective ways to protect yourself and others from severe illness, hospitalization, and death. Other preventive measures include wearing a mask in public indoor settings, especially in areas with high transmission rates, washing your hands frequently or using hand sanitizer, and staying home if you're feeling unwell. Treatment for COVID-19 depends on the severity of your symptoms. For mild cases, rest, fluids, and over-the-counter medications can help relieve symptoms. In more severe cases, hospitalization may be necessary. That's it for today's video, everyone. We've covered a lot of ground, from the common cold to COVID-19. Remember, knowledge is power when it comes to your health. Stay informed, take preventive measures, and seek medical attention when needed. And as always, this video is for informational purposes only and should not be considered medical advice. If you have any concerns about your health, please consult with a healthcare professional. Stay healthy, my friends, and I'll see you in the next video.